So this project has to do with surveillance of soil-transmitted helminths, or what I'll refer to as STHs, during this talk. Globally, we know that there are 1.5 billion people infected with soil-transmitted helminths. Soil-transmitted helminths are basically parasites that infect humans and are widely distributed in tropical and subtropical areas, with the greatest numbers really occurring in sub-Saharan Africa, the Americas, China, and East Asia. We know that over 267 million preschool age children and over 568 million school age children live in endemic areas. Currently, we do not know what the distribution of these infections remain as in the United States, and that is actually a huge component of what I'm about to talk to you today. These infections are important because they do contribute significantly to impairments in children, including nutritional, which translate into both physical and cognitive impairments in children and very chronic illnesses. Soil transmitted helminths in general are caused by various species of parasitic worms, as I alluded to earlier. The major ones include Ascaris, Trichuris, Necator americanus. These are the roundworm, whipworm, and hookworms that infect humans. We know that transmission usually occurs in those who are living or residing in more resource limited settings, and that's specifically because the transmission of these diseases is from soil, as their name is given, through eggs which are shed in human feces from those humans who are infected into contaminated soil. And in areas of poor sanitation, of course, you can see how the human cycle of transmission can be set up, that if eggs are shed into the soil and children are running around without shoes, they can easily become infected with these diseases, which can cause chronic illnesses. These eggs also can be found in water for those who are perhaps preparing food and not washing their hands properly, in food and water sources. And we know that the eggs passed in feces do need about 3 weeks to mature in the soil before they become infective, but they still become infective in that period of time. And so, of course, as you can see, can impact those who are subject to being infected by coming into contact with contaminated food, water, and soil sources. So there is no direct person-to-person contamination or infection from fresh feces, but there is infection from contaminated sources if the eggs are shed and have about 3 weeks to mature. These are some pictures from the CDC website. This is a hookworm egg and adult worm, and this is basically to show you what these particular parasites can look like. So the soil-transmitted helminths, in terms of control programs, there are very specific control programs that the World Health Organization supports or gives guidelines or recommendations for. And periodical deworming campaigns are supported and recommended by the World Health Organization. Treatment should be given once a year if the baseline established and known prevalence of the area for soil-transmitted helminths infections in the community is over 20%. And twice a year should be given. So treatment twice a year should be given if the prevalence of soil-transmitted helminth infections in the community is over 50%. We know very clearly, because of the methods of transmission that I just described, health and hygiene education are extremely important components to reducing transmission and reinfection by encouraging healthy behaviors. So it's important to note that one can treat these infections, as mentioned in the first bullet point here under periodical deworming. However, if there is no source remediation, if there is no health and hygiene education, reinfection can occur very, very easily. And so you can imagine, in areas where there's significant health disparities, the great challenges that accompany some of these recommendations. Provision of adequate sanitation is highly important and essential, but of course not always possible, also in resource limited or resource poor settings. So these are some slides taken directly from WHO's website, talking about or referencing specific recommendations that have been given for large-scale deworming projects to improve the health and nutrition of children. These are different press releases, also referencing various pediatric chewable medicine forms that are available to help improve treatment against these soil-transmitted helminths and intestinal worms. And some other press releases that actually, of course, give you the startling numbers in terms of how many donated tablets have been donated. For example, in 2018, you see 485 million, and that's still not enough, of course, to completely eliminate the soil-transmitted helminths, nor the, of course, health disparities that contribute to these diseases. But you can see these numbers are so high, you can imagine the challenges that remain in terms of eradicating these diseases that contribute to the cycle of poverty in children. Soil-transmitted helminths in 2017 were addressed in an updated evidence-informed guideline published by the World Health Organization that did talk about regular large-scale treatment of people against intestinal worms, and some of those numbers were referenced in the previous slide. The guidelines do endorse the current practice in areas endemic for these three main parasites that I described to you earlier that cause this disease, and WHO recommends and endorses the use of very safe medicines, including albendazole and mebendazole, which are very safe and have few minor side effects. And these medicines are usually donated to national ministries of health through WHO in endemic countries for the treatment of all children of school age. Again, of course, what must accompany this is source remediation and education. Overall, the global target, despite these numbers that I quoted you in the past few slides, is to target to eliminate the morbidity due to soil-transmitted helminthiasis in children by 2020. And this basically would have to be obtained by the current goal of regularly treating at least 75% of children in endemic areas, which would equate to an estimated 836 million, which was the estimate in 2016. In addition, we know that even further back in 2001, the World Health Assembly did, preceding all of these declarations by WHO, take a historic step to try to reduce morbidity and mortality associated with basically the world's most common parasitic infections, which happen to be these soil-transmitted helminths. However, with 2020 on the horizon, as I mentioned in the previous slide, major challenges, of course, still remain, not the least of which is, of course, the daunting numbers, but the need to maximize the impact of pharmaceutic donations of anti-helminthic drugs. So not only WHO's providing them, but distribution and primarily being able to afford the donation of them to begin with, but also what would help in this effort is the efficiency or the need to clarify specific targets to guide monitoring efforts moving forward. And that's also where we come in the great state of Mississippi in talking about poverty, infectious disease in the American South, and global health, which actually does in fact, of course, also apply to the state of Mississippi. And establishing those targets for treatment includes, of course, surveillance and understanding and appreciating the full extent of the distribution of these infections. It is thought that in the American South, we still do suffer from a number of diseases of poverty, neglected diseases of poverty, which you see lists for there, but which we address specifically here as the soil-transmitted helminth infections. There was a study that was released in 2015, presented at the American Society of Tropical Medicine and Hygiene Conference, that looked at a very, very small number of subjects in a rural county in Alabama, and they found a surprisingly and alarmingly high rate of hookworm in this particular very small study. And the question is really, previously we thought these diseases were eradicated from the American South, or at least at a very low level, but this study suggests that these diseases may be present in higher numbers than we had previously thought. There are, of course, potential issues with this study in terms of how the study documented these infections by a specific methodology using polymerase chain reaction versus the gold standard, which is still microscopy, but nonetheless, this has prompted many investigators in the American South to now look to readdressing whether or not these diseases still exist in a wide spread scale, and whether or not further efforts are required to address these infections in the American South. So to that point, this is the diaper of a patient who was seen by a pediatrician in the state of Mississippi who contacted our service for further assistance. And this is basically probably quite alarming as a mother to see in any diaper, but this is actually an Ascaris worm. So we do still see these infections in children in the state of Mississippi, and the question is really how widespread are these infections? We know that the soil-transmitted helminths, as first described by Dr. Charles Stiles in 1902, were probably the reason for a great number of people in the American South suffering from chronic fatigue. And Dr. Charles Stiles was a zoologist who actually worked in Germany, who recognized the signs and symptoms of hookworm that he had seen in colleagues of his who took care of patients, anemia and fatigue, and the diagnosis of hookworm disease being made in European patients. And he referenced the knowledge of these cases and extrapolated that perhaps people in the American South were suffering from similar afflictions. And it was really because of his efforts that the Rockefeller Sanitary Commission for the Eradication of Hookworm Disease formed and came to the American South, including Mississippi, Alabama, Georgia, and conducted a mass treatment campaign, mapping the disease, treating patients, and providing education as a campaign in the American South. And it's been largely assumed that since this campaign that perhaps these diseases really don't exist in the South anymore, but as I mentioned earlier, they probably do, and as the diaper shows you, they probably do. And the question is, really has improved sanitation really been able to contribute to the eradication of these diseases? And there's a question mark next to that specific point on my bullet points, because we know specifically in the state of Mississippi, there are many areas that are more resource limited where there's significant health disparities in which people reside in areas of extremely poor sanitation, and perhaps actually absent areas that are absent of any sort of proper sanitation or sanitation at all. There's also a lack of local expertise for diagnosis of these diseases, even at University of Mississippi Medical Center, which is the major academic medical center within the state. The clinical lab outsources sending samples to Mayo Clinic in Minnesota to do ova and parasite exams on stools for diagnosis of these infections. In addition, many clinicians don't even think these diseases are actually a problem anymore, and as you can see from the diaper slide, that they definitely are. And so there definitely is a lack of continued awareness. And as I mentioned, we do know there's areas of poor sanitation in the state of Mississippi, and the recent study done in Alabama certainly underscores the importance of us performing more recent surveillance than this map indicates. So this map actually is a compilation of data from the Rockefeller campaign, which was conducted in the American South, as I mentioned a few slides ago. And the darker spots in this map are the areas in which the highest prevalence of hookworm, in particular, as a soil-transmitted helminth, was diagnosed and actually these are infection rates, so was diagnosed and also, of course, were treated. The lighter brown spots are where there was less prevalence, and of course the lightest are the areas of the least prevalence. But you can see that this map actually includes a large part of the state of Mississippi where there's quite a bit of work done. The white spots within the state indicate areas for which there was not data available. So as I mentioned earlier, more than a quarter of the world's population is at risk for soil-transmitted helminths. Those include hookworm, ascaris, and other worms like trichuris. Strongyloides is another soil-transmitted helminth, which can actually confer significant morbidity and mortality. These diseases, again, contribute to chronic malnutrition, anemia, malabsorption. Symptoms, again, are very vague. And again, as you can imagine, in parallel to decreased awareness, if children are promoting with stunting of growth and delays in cognitive development, these symptoms are very nonspecific. And if there's not the awareness in the clinical community to look for these diseases, they will remain undiagnosed and, of course, contribute to continued health disparities and poverty promotion. These diseases can, in rare circumstances, present with very drastic symptoms, such as the strongyloides cercolis hyperinfection syndrome, in which a patient who's been chronically infected may be given steroids for one reason or the other for a medical illness, say, for example, asthma, and they progress into hyperinfection syndrome, which itself has an extremely high mortality rate. But more often than not, these diseases present very insidiously. So because of all this information I've just presented taken together, we decided to conduct some preliminary studies to categorize soil transmitted helminth or STH prevalence in our state. And we started working with Dr. Lisa Haney in the School of Nursing, looking at school-aged children in Sharkey-Sequina counties and the South Delta Elementary School District. And in parallel to that, conducted convenience sampling study through the University of Mississippi Medical Center clinical microbiology labs. What you can see is a little picture here for the school-based clinic where we collected samples from children to collect pilot data to look at the underlying prevalence in a pilot study in children in the specific area. And there's Lisa Haney, Dr. Lisa Haney, on the Mercy Delta Express bus, which provides health care to resource. And so that leads to what we're doing right now. The ongoing study that we are currently funded by CDC to do involves looking at areas that have the confluence of risk factors of having had previously historically high prevalence for these infections, areas in which we know from looking at recent records with DOH or the Department of Health that there are areas of very, very poor sewage. And in addition, the environment is, of course, important in terms of the type of soil, because certain soil types are more conducive to these infections than others. And that's why I have this map here to show you that on the left, what you can see in the darker gray areas are the areas where there's loamy soil in the state of Mississippi. And on the right, if you actually looked at those two maps overlaid together, you would see that there's a confluence of where you have the loamy soil and the higher prevalence of hookworm. That's not a coincidence. That's specifically because hookworm happens to thrive in loamy soil, and that's basically true for other STHs. And the reason for that is mostly because water will seep just enough into loamy soil, but still remain close enough to the surface where there's warmth. And that's exactly what hookworm likes, is nice, warm, moist environments and staying close enough to the surface that if you run through sandy, loamy soil with bare feet, they'll be able to get right in to your skin and continue the human transmission cycle of specifically human hookworm, as that's what these data specifically refer to. And so our study is basically one in which we're now enrolling children ages 2 to 18. Each child will have basic history and physical data collected and risk factor data, including exposure to raw sewage, soil, what pets or animals they've been exposed to, and whether or not they've traveled anywhere. Basically, we are collecting these data in addition to dried blood spots or a spot of blood from each child to look again for evidence of infection or exposure with the various parasites that I've talked about in previous slides. In addition, we're collecting 3 stools per child. 3 stools is actually the gold standard and is more sensitive than even what we did in our previous study, in which we collected 1 stool per child, the previous data that I showed you. And so we expect that this study will be much more comprehensive in the highest risk regions that we've identified by all the data that I've just mentioned to you. And specifically, the first study is going to be done in Rankin County because Rankin County does actually possess the criteria of the 3 risk factors: historically high prevalence, sandy loamy soil, and regions of poor sewage that actually could all come together to sort of form the perfect storm for a child being exposed to and infected with hookworm or other soil transmitted helminth. And so I'd just like to acknowledge at the end of this talk, of course, the children and participants in all of our studies, of course, the support of the University of Mississippi Medical Center, the continued excellent, wonderful relationship and collaborations and support we've had from the Mississippi State Department of Health, and of course, funding from the Centers for Disease Control and Prevention. And so I thank you for your time and attention today, and hope this lecture was interesting and helpful.